Hi everybody, my name is Dr. Ais. Today we're talking about knee pain, so pain in the front of your knee. So we're going to talk about what it is, why you have it, and how to get rid of it. So first off, I want to talk about why, but I know you came here to figure out how to get rid of it. So I'm going to skip to the exercises right now, so you can see those right now. So I'm going to go ahead and get the foam roll underneath my quads, which is these big muscles right in front of my thighs, and I'm going to put my elbows on the ground. So when you're doing this, try to not let your body sag like this. Keep this a little push forward, and you're just gonna roll back and forth as you slowly breathe. Next one's gonna be a bridge. So you're gonna go ahead and lay on your back. Your feet are gonna be about hip width apart. They might have to be a little bit wider, especially if you have a lot of tightness on the outsides of your thighs. A little scoop of your pelvis, full breath in, exhale. Lower belly, middle belly, rib cage all get smaller. So you have some tension through your belly. You have your foot contacts. When I say foot contacts, I mean that tripod of your foot. So that's just gonna kind of set your entire body up to perform this exercise correctly. Then you're gonna go ahead and lift up. So you feel those foot contacts. You're gonna feel your butt lifting you up towards the ceiling, and you're slowly gonna breathe in this position. So in this position, you have your rib cage stacked over your pelvis. You feel your belly muscles on. You feel your glutes driving your hips up towards the ceiling while your feet are on the ground. And depending on who you are, you can play with the foot distance. So some people might need to bring it a little further away from their butt, and then some people might need to bring it a little closer to your butt. A little closer to your butt kind of makes your glute muscles kick in a little bit more, and a little bit further away allows those hamstring muscles to kick in a little bit more. Both are good. So next exercise is going to be a hip flexor stretch. So we're kind of in this half kneeling position. So one foot's in front, one foot is going to be in the back. So what I want you to do is you're going to do a little scoop of your pelvis. So just like this. This is going to get that rib cage stacked over your pelvis. You're going to reach one arm forward, and you're slowly going to lean forward a little bit, keeping that tuck in your hips. And you're going to feel a little stretch in the front of your thigh. In this position, I want you to just slowly breathe in and out through your nose, hanging onto that stacked position of your rib cage over your pelvis. Okay, so next we're going to learn how to shift onto one hip. So this one right here, we're going to be loading onto one hip. When you're doing this, you're trying to keep that toe, knee, hip all in alignment as you're loading onto that side. From the side, you could see my weight is shifting back on my hip. There's going to be a little bend in my ankle. And you're just going to shift from side to side, trying to keep the load on your hip. We talked about that stacked position before, and we're trying to maintain that in this exercise. That's going to help us load onto our glute to feel this in our glute as we're doing this exercise. So the main thing that I like to talk about is why you're getting this pain. So why you're getting this pain might be contributing to why you're getting the symptoms, but other symptoms and other places in your body. So I'm going to talk about this in terms of the knee. When I talk about this in terms of the knee, I want you to keep in mind that I'm talking about everywhere else as well. Because I know you might be experiencing knee pain right now, but are you getting pain in other places in your body? Or are you starting to develop pain in other places in your body? So I'm really trying to look at the body as a whole, but I'm really talking about your knee. But let's get into it. So pain in the front of your knee. So this is often described as either patellofemoral pain, patellotendinitis, chondromalacia, things of that sort. So front of your knee. Let's get my man. So you have your kneecap right here. So every time you move your kneecap is going to move up and down. So every time you bend your knee, your kneecap is going to go downward. Anytime you straighten out your knee, your kneecap is going to move upward. So front of your knee, big fangs right here. We got our quads. Quads are in the front of the knee. They straighten out the knee like this. In the back, hammies. So these are in the back of the knee. These bend your knee. Back, you have your calves. These also attach to the back of your knee. They do this. And on the insides of your knee, you have your adductor muscles. So these, again, big fangs right here. They do this. So you have all these muscles acting at your knee joint. So there's other things in there, but that's kind of a basic level. So all of these muscles are going to influence your knee. So when we're talking about pain in the front of your knee, a lot of the times these quad muscles get turned on too much. So these quad muscles stay on. way too much. A lot of us, if you notice in your exercises and you're targeting your glutes all the time, like you're in the gym trying to develop your glutes, but you leave the gym and you're like, oh, these damn quads, they are massive and they just take over and they just do everything. You also might find in doing your exercises, you might find your back stays on a lot too. So you might notice after your exercise, you have really tight, sore quads, very tight, sore backs, and the butt's getting no love at all. And that sucks because that's the purpose of the exercise, right? So I know a lot of people, they go to the gym to get these glutes and you're like, yo, bro, where you at? And keep training them and keep training them and you keep trying different things to try to get them. But it's like, bro, you're not there. But you know what is there? These things. So why does this happen? All right, so why does this happen? And why am I going to give you this full long explanation instead of just giving you exercises to fix your knee? So a lot of us were anteriorly oriented in our spine. What this could look like is your rib cage kind of coming forward, your pelvis kind of coming forward. So what this does, like I talked about before, this biases our quads. So these big muscles in the front to being on all the time. So these quad muscles, they stay on whenever we're doing our activities throughout the day, but they also get overdeveloped and they stay even more on when we're training them in the gym. This happens because when we stay in this orientation of the spine, it just puts our quads in a better position just to stay on. And you know, that's just what they do. And when your quads stay on, and remember, we're talking about those quads, they attach to the kneecap in the front of the knee. They stay on all the time. So anytime you bend your knee, you're getting a lot of compression in that knee joint. So your kneecap is just banging into that joint anytime you bend your knee. A lot of the times when we have this tightness in our quads, our hips are going to be a little bit more outward. So we're going to have a lot of tightness in the back through here. So when that happens, we get more tightness in the side of our leg. So that kind of pulls your kneecap towards the side whenever you bend your knee. And that could give you some pain, maybe on the inside or outside of the knee, even more or less. So I gave you this big, long explanation. Why are you telling me all this stuff, and how do I get rid of my knee pain? Like, why is this so important? It is so important. Okay, so we talked about our quads before, staying on. So when I talk about staying on, so our muscles are supposed to be able to let go and lengthen, and they're also supposed to be able to contract. What happens when they stay on more often, your quads stay in this shortened, contracted state. Like I said, your muscles need the ability to let go, but they also need the ability to contract. So staying like this all the time doesn't feel good, as you probably know. Okay, so we want to get these muscles to let go. So one of the exercises that I put in here is some soft tissue work of your quad muscles. So what I do for myself, because I have the ability to do this to myself, is I needle my quads. So what that does is it causes a twitch response of my quads and it gets them to let go a little bit and reset. But what you can do at home, instead of doing this dry needling, is just foam rolling of your quads. So this is just going to get them to turn down a little bit. What that's going to do is it's going to allow those muscles to be able to lengthen a little bit better, and it's going to take some of that compression off of the front of your knee, but you can't stop there. So just because you're doing some soft tissue work of a region does not mean you solve the problem. So yes, it's going to let go for a little bit, but if you don't address why these muscles were so on in the first place, it's just going to come back. So that's why I said it's really important to know the whys. So doing that soft tissue of that region might help you feel a little better. It might take some of that compression off your knee, which is what you're trying to do. But there's other influences that you need to address. So like I said before, a lot of us are in this anterior orientation of our spine, you know? And when this happens, that's what turns the quads on. So we need the ability to come out of this anterior orientation. So get our rib cage to come back, get our pelvis in somewhat of a neutral position to get our rib cage stacked over our pelvis. What this is going to do, it's going to allow us to be able to shift weights onto our hips, to load our hips, so that we're not doing the entire motion just from our quads and our knees. So I put one exercise in there to get that rib cage stacked over that pelvis, incorporating that breathing and core work. So that's going to allow you to be eventually, maybe not now, it takes a while to build up, to be able to shift onto your hip. What comes with this forward position is having those hip flexor muscles tightened or in this on position, kind of like what the quads are doing. So we need the ability to let these muscles let go. These muscles are very deep in there, so you're gonna have a hard time trying to foam roll out to your hip flexors. So we're gonna target that by one, lengthening it. So bringing the muscle to a more lengthened state. I don't mean crank it all the way to the end range. We're gonna bring it to a more lengthened state, and then we're just going to breathe in this position. But when we're breathing in this position with our rib cage stacked over our pelvis, we're allowing our body to just relax. And when we're able to relax, some of these muscles are able to let go. So also when we're working on this breathing sequence, we're working on our diaphragm. So our diaphragm is our primary breathing muscle. So a lot of times in this anterior orientation, those hip flexor muscles, they help assist us in breathing, more specifically on the left side. So these hip flexor muscles help us breathe, they help us move, and they stay on all the time, just like these quads do. So in breathing in this position, getting that rib cage stacked over your pelvis and slowly breathing in this position, it's gonna allow those hip flexor muscles to let go, which is gonna allow those quad muscles to let go a little bit as well. All right, so we have our quads that let go a little bit. We had that stacked rib cage, maybe not. Now we need to be able to work on to getting onto one hip. So a lot of the times when we're squatting and whatnot, and we squat predominantly by bending at our knees, and we don't get as much weight onto our hips. So we don't have the ability to kind of hinge and load onto our hips. We're doing more with our quads and we're putting more pressure on our knees. Not necessarily a bad thing, but if you're experiencing knee pain, you probably gotta change something up. So being able to load onto a hip is gonna be very important in this. So that's why this hip shifting activity is in there. So what this does is it teaches us to load onto our hip. So we're able to open up all these things back here to put some of this pressure on this area, but more pressure on the butt and less through this area right here. So you need to be able to have the ability to load onto that hip to offset your knee. Okay, so hopefully feel equipped in handling your knee pain. So biggest takeaways here is 1, get this quad to calm down a little bit. Number 2, get that rib cage stacked over your pelvis. Number 3, get this hip flexor muscle to let go a little bit. Don't crank it, please don't crank it, and just slowly breathe in that position. And then 4, make sure you have the ability to shift and load onto a hip so that you're not just loading onto your knee when you're doing these exercises at the gym. You feel like you got some good information, but you're still confused. And I get it, because knees are highly complicated, just like the rest of our body. So if you feel like you're a little confused still, 1, comment below, ask me questions. I love to hear your feedback. But also if you're looking to reduce your knee pain and other aches and pains in your body for that matter, check the link below for my Optimal Mobility and Function program. So this is a group program and course that's going to teach you how to, 1, improve your mobility in all places of your body, because everything's connected. It's going to teach you how to stack that rib cage over your pelvis so that you're able to activate those core muscles properly and then load onto your hip appropriately. And then teach you how to work out and get strong, because just getting rid of the knee pain is not the ultimate goal. So we want to get rid of that knee pain, but we want to be strong so we can do everything we want to do throughout life, look bad at the same time. Don't forget to like, subscribe, share with a friend if this helped you out, and I'll see you guys next time. Bye.